Good evening, you're watching The Big Story with Haryanto Diman. I'm Olivia Quay. If you're watching us on YouTube, subscribe to the Straits Times channel if you haven't already done so.
We begin with the latest in Singapore. The Health Ministry confirmed 305 new COVID-19 cases today. Infections among Singaporeans and permanent residents continue to remain low, with 2 new cases reported. Foreign workers living in dormitories still form the majority of the remaining cases.
Today's lower number is partly due to fewer tests being processed, as one testing laboratory is reviewing its processes following an earlier apparatus calibration issue. The lab will need time to ramp up its testing capacity. The total number of cases in Singapore now stands at 20,343, and MOH will release more details later tonight.
Meanwhile, the internet was abuzz over the weekend, with netizens sharing a Facebook post showing people not complying with safe distancing measures at Robertson Quay. They were gathering in crowds and drinking. Many of them were not wearing masks.
Some restaurants at the Riverside area have since been barred from selling alcohol for takeaway. The Urban Redevelopment Authority told the Straits Times yesterday that these restaurants had sold takeaway alcohol to patrons, which led to more individuals gathering around the premises.
Netizens called the people out on their behaviour, saying they were selfish and disrespectful of frontline workers. Separately, there are still reports of people not adhering to circuit breaker measures.
With the scheduled easing of the circuit breaker just 2 weeks away on June the 1st, are people getting complacent? Or is it a case of circuit breaker fatigue accumulated over the past 2 months?
To shed more light on this, we're joined by infectious diseases physician from the Rofi Clinic, Dr. Leong Ho Nam. Doctor, are people getting complacent? I mean, the situation in Singapore may after all seem promising, with the number of community cases in the past week at single digits, and for the past 5 days the number of patients discharged has exceeded new patients as well.
I think this is some good news at the end of the tunnel, or rather close to the end of the tunnel. We're seeing much fewer community cases, more and more discharge, and I think all this is bringing a lot of cheer to many people. Now, you must understand that Singaporeans have been going through cabin fever. So everyone's really tired and everyone's longing to go out. But unfortunately, this is not the time yet. Why? If you look at the specifics, our community transmissions, which are unlinked, we still have 1 to 0 cases, which means someone is still spreading the virus out in the community. If we are not careful, we're going to have a wave after the lockdown, after the circuit breaker has been released. And the wave could come as quickly as 2 weeks or even shorter from the 4th of June, and all the good work which we have done could be wasted just like that. Singaporeans, you cannot be complacent now. Singaporeans, I'm asking you to dig in further for another 2 weeks, and everyone just chip in and just control ourselves, our urges, our need for our bubble tea and the haircuts. Just hold on for a while, and we do it for another 2 weeks, and we can bring the number down to 0 consistently. Now remember this, Korea had a very good control, but they had one night of a good break, and then they ended up 119 cases from one patient going to 5 nightclubs. In the case of Hong Kong, where there's several weeks of 0 cases, and thereafter there 1 case, and after that it spread on to quite a few other individuals. So Singaporeans, dig in. This is the last run. Like the marathon, the most difficult is the last kilometer, and we're going to complete it well and finish it well and win the crown for ourselves.
Well said, Dr. Leong. So we're 2 weeks away from the easing of the circuit breaker measures on June the 1st. How crucial are these last 2 weeks in our fight against the virus? You alluded to it in your earlier answer.
Yes, it is very important. Now, there's a law of diminishing returns. The last case is always most difficult, and you have to stamp in even harder to get rid of the last case. So Singaporeans, the last 2 weeks now, bite on, push on. The tighter we are in controlling ourselves, in going out and meeting people, the more likely we're going to get rid of the last case. If we don't do it now, we're going to lose the good effort we're putting for circuit breaker, and we may just come up with another circuit breaker as quickly as mid-June. I dread that. I don't want that. I'm praying against that. So everyone dig in. 2 weeks more of good work, and thereafter we are out of it.
Mm. Doctor, you mentioned about it being a marathon and this is the last lap. Now, what should people expect in the lead up to the much anticipated day, June the 1st, and beyond, of course, the circuit breaker?
I think there'll be more and more cabin fever. I can hear a lot more grouses coming out. Can you believe that people have actually emailed me and tell me, please don't extend the circuit breaker? Unfortunately, I have no power over this say at all. Now, I'm going to ask everyone. I anticipate that more and more companies will be released to restart some of the work, or at least preparatory work, so that the companies can go online. I do hope that with the numbers that are falling, the government will reconsider opening some of the shops earlier than later, rather than all and many shops at one go on the 4th come early June. The run up, I think there'll be little differences. Otherwise, for those non-essential services, I expect you to work as very much the same as in working from home. And for those people who are busy preparing the food for us, preparing the food for the foreign workers, or doing the essential services, wear your mask, keep your distance, wash your hands, and even though you're working there, be very careful, don't get infected.
Well, thank you so much, Doctor, for the advice. As always, it's a pleasure to speak with you. We were speaking to infectious diseases physician from the Rofi Clinic, Dr. Leong Ho Nam.
Concession card holders will be automatically refunded the unused value of their monthly concession passes until the end of the circuit breaker period. TransitLink said two groups of commuters will receive these refunds: those who bought their monthly concession passes before April the 4th and those who bought them between April the 4th to the 21st. All refunds can be redeemed from June the 2nd to August 31st at any add value machine or TransitLink kiosk.
Meanwhile, the Institute of Technical Education and the 5 polytechnics will largely conduct early admissions exercise selections online for most courses. The Education Ministry said that for courses where the selection process cannot be replicated remotely, the institutions will ensure that safe management measures are implemented. These include staggering assessment slots and designating waiting areas to avoid the intermingling of applicants.
The Health Ministry has told doctors to refer children who may have symptoms of a severe immune disorder perpetually linked to COVID-19 to the KK Women's and Children's Hospital and the National University Hospital. The ministry that this condition in children remains very rare and information is still emerging on its link to COVID-19. As of May 14th, all children in public hospitals here who have tested positive for the virus had either mild or no symptoms, and MOH said none of them fit the case definition of the severe immune disorder.
A new autonomous drone system which lets a drone take off and land and even recharge its own batteries is currently on a police trial. Details of its operations can be configured and monitored remotely, so a pilot doesn't have to be on site like in usual drone operations. The trial is currently done at an industrial estate in the western part of Singapore, but there are plans for the system to be extended to residential estates later in the trial.
Across the causeway, Malaysia's parliament convened for the first time since Perikatan Nasional took over as federal government.
But in another historical first, it sat for just one day and only hosted a speech by the king. In fact, the session lasted just 45 minutes. This left no time for representatives to discuss policies for addressing the pandemic or go through a planned confidence vote against Prime Minister Muhyiddin Yassin.
Let's delve deeper into this with the Straits Times Malaysia Bureau Chief Shannon Teoh. Good to have you back on the show, Shannon. So, although today's parliament sitting was short, did it reveal where party loyalties have settled in the seating arrangement, for instance?
Well, I think we largely kind of got a rough idea, plus minus one sort of thing, and it did turn out like that. So the government bench revealed that they had 114 MPs, one more than we expected, and the opposition had 107. and one remaining as an independent. This isn't so. Muhyiddin has one more MP than we thought. This is still pretty precarious for him because simple majority is 112. He's got 114 now. We don't know if what could happen in the future. Of course, you could be sitting at a particular position, but your heart and your mind is thinking something else. When it comes to the point to actually vote on something, people could vote either way. At this point, no one's loyalty has actually been tested.
Shannon, Parliament ended proceedings once the King completed his opening speech, meaning it didn't hear Mahathir Mohamad's motion of no confidence in Mr. Muhyiddin. Where does this leave Dr. Mahathir?
Well, I think we shouldn't really get caught up in whether the specific motion of no confidence is heard. There are many ways to show that the government does not have the majority. For example, the Muhyiddin government has announced a stimulus package for the coronavirus to the amount of about 35 billion ringgit. He has to get this approved in Parliament. You cannot spend any money unless Parliament says you can. This has to come up to Parliament at some point. And people believe that it will be in July when Parliament returns. The government, if it loses that vote, that would be pretty major because it is a supply bill. It is a bill about money. The government cannot operate without spending money, obviously. And if the opposition succeeds in defeating that vote, then that would amount to a motion of no confidence in itself.
Right. Well, Shannon, Malaysia's ruling parties announced their support of Perikatan Nasional in an MOU yesterday. On the one hand, it ties together a simple majority in Parliament of at least 112 MPs. But on the other hand, this agreement doesn't detail any political arrangements. So how significant is it actually for Mr. Muhyiddin?
I think for the Prime Minister, what it does secure for him is that these parties are behind him. They say they're behind him, and that they will govern together according to so and so agenda. The list of policy priorities are not very surprising. They're probably the same thing every government says they will do. But it does signal that they are going to be behind him and he will have the numbers to govern. The problem here is that it doesn't say anything about a political or electoral cooperation. If a general election is called, there is nothing in that MOU which says that yes, we will all work together, we will campaign for each other, we won't try to sabotage each other, things like that. That doesn't exist in the MOU as it stands right now. So if you were in Muhyiddin's Bersatu, well, the part of Bersatu that is with the government, not the part of Bersatu that is with Mahathir, you'd be concerned because you would be going up into the next election without any allies. You are not part of Pakatan anymore because you say you've pulled out, but you're also not part of any alliance with UMNO, especially, which is the biggest party in the country. UMNO is leading Barisan Nasional, the coalition that lost the last election, but they also have an electoral arrangement with the Islamist party PAS. So they have secured certain cooperations, a kind of certainty for themselves in terms of who they can rely on in the next election. Bersatu does not have that. So if you're one of Bersatu's 32 or 33 MPs that they have right now in government, you'd be concerned because you'd be going up against some heavyweights in the next election from both the government and the opposition.
Well, thank you so much, Shannon, for taking time to speak with us. As always, we appreciate your insight and analysis. That was our Malaysia Bureau Chief, Shannon Teoh, joining us from Kuala Lumpur. Malaysia's parliament set for only a day in a historical first. The next session will take place on July 13th. For more news around the world, it's over to Dylan Ang.
Thanks, guys. The death toll in several European countries hit a new low for the first time in weeks. The UK reported 170 deaths yesterday, its lowest since late March when the lockdown was first introduced. Similarly, Italy saw 145 deaths, its lowest toll since its lockdown began. Spain reported 87 deaths, the first time it dropped below 100 since a state of emergency was first declared on March 14. India extended its nationwide lockdown till May 31st, but it further eased certain restrictions aimed to boost economic activity. Sports complexes and stadiums will now be able to operate, albeit without spectators, and interstate travel will be allowed with permits. Public transport, schools and tourist spots remain closed. South Africa reported a 24-hour record of 1,160 new infections yesterday, its highest since its first case was recorded in March. Its Western Cape province accounted for nearly 60% of the numbers. The national total is now over 15,500. Health systems in Brazil's largest city, Sao Paulo, may be on the verge of a collapse as demand grows for emergency beds. According to its mayor, public hospitals have reached 90% of its capacity and could run out of space in about 2 weeks. Brazil overtook Spain and Italy over the weekend as the nation with the fourth highest number of infections, with more than 241,000 reported cases. Elsewhere in South America, the first coronavirus case was detected in one of Ecuador's indigenous Amazon tribes. She's believed to be a pregnant 17-year-old from the Waorani tribe. Human rights organizations warn that the COVID-19 spread for their community may be catastrophic and highly lethal. That's all for our global updates. Back to you.
Well, thanks so much, Dylan. There's no proven treatment for the coronavirus, so medical care is supportive to give patients their best chance of fighting the disease. Most patients recover on their own without needing intensive care. To find out more about what these patients go through, I'm joined by Dr. Graeme MacLaren and Dr. Jyoti Somani. Dr. MacLaren is the director of the cardiothoracic ICU at the National University Heart Centre, Singapore, and Dr. Somani is a senior consultant at NUH's Division of Infectious Diseases. So based on yesterday's figures, there are 1,210 patients in hospital, 16 of whom are in the ICU. Dr. MacLaren, you specialize in ECMO treatment, a form of life support. What factors determine a patient being admitted to the ICU to be treated for COVID-19?
So intensive care units have two things that a normal ward doesn't. One is it has one nurse per patient. And the second thing it has is a much wider variety of monitoring and life support technology. So with COVID, we've learned that these patients can sometimes deteriorate quite quickly. And because of the infectious risk to the staff and everybody else around them, it's important to try and anticipate this need in advance. So we have generally been admitting patients to intensive care earlier than we would otherwise to prepare for any potential deterioration.
Well, let's bring Dr. Somani in on this conversation. I understand around 80% of COVID-19 patients don't need any treatment, but they are closely monitored for complications. So, Dr. Somani, what is the general mood among the patients as you make your rounds?
Well, to be honest, the mood has actually gotten much better. Back in February, there was a lot that was unknown and patients were very fearful. I think they had looked at what had gone on in Wuhan. And then in March, people were looking at Italy and the US and were quite fearful. But now, given how well we've done in Singapore and with the understanding that the majority of patients do well without any treatment and without having to go to the ICU, the mood has certainly relaxed a little bit more. So that's quite gratifying for us.
Dr. MacLaren, what have been the hardest or the most challenging aspects for you so far?
I think the dominant problem with this has been the fact that this virus is so contagious. And I don't think most doctors have lived through this level of disease before where there's so much concern about infection spreading to everybody around them. So I think the contagiousness is an issue. I mean, the first time you ever walk into an intensive care unit that you know is full of COVID patients, it doesn't matter how experienced you are, you notice the difference. The other thing about this disease is that it's obviously a new one. And whilst it shares a lot of similarities with other viruses, it has some nuances, it has some new things about it that we're still learning about. And keeping up with this avalanche of medical publications in this area, I think is keeping everybody very busy.
Right, of course. So my next question is for the both of you. Do you get to experience any high points? Is there a silver lining as you tackle the virus, as you meet some patients, some of whom are very, very ill? Dr. Somani, why don't you go first?
Well, definitely there are silver linings. We've had many patients who've gone to the ICU and been quite ill who have recovered, and that's always very, it feels very good to see, and it's nice to see their families as well become a little happier and relieved when their patients do well. I would say the other big silver lining that we've never had before, but because this is a pandemic, has been how the whole medical staff and the entire hospital has pulled together, and that includes all the way, from environmental services to security to the nursing, as well as allied health, all really pitching in and coming together to make sure our hospital is safe for our COVID patients, as well as our non-COVID patients, and also for all our healthcare workers. And that's really been very, very gratifying and happy to see that we can do that. I think it's just unprecedented that we've been able to pull everyone together and be prepared. So that's also the silver lining.
Well, Dr. MacLaren, how about you? How do you get through each day?
Well, there's so much to do, I don't really have a chance to reflect on it. If you're looking at silver linings, I think one about this particular virus is that it hasn't really affected children very much. There's lots of viruses that preferentially affect young children. Look at hand, foot, and mouth disease, for example. This one, on the other hand, seems to make patients who are elderly or who are male or who have vascular disease, they do much worse. But at least children, with very, very few exceptions, don't seem to be affected by this. And that is perhaps one silver lining.
Well, Dr. MacLaren, what is one other thing that we haven't talked about yet that you would like the public to know?
I think the important message here is that it's the virus, whilst it's been unprecedented, it's under control in Singapore, and the resources and the foresight to deal with it, and it will go away, or diminish to a thing which doesn't affect our daily lives to remotely this extent.
Well, Dr. Somani, then over to you again. What is the one message you'd like to share with our viewers?
I think that while we are well prepared now in Singapore and our hospitals are well prepared, I think we will see probably in the short term an increase in cases when the circuit breaker is eased up. But I just also want to let the public know that if you have other emergencies not related to COVID, it is quite safe to come to our hospitals now. We have triage in place. We know how to keep our patients safe, all of them, whether you have COVID or unrelated symptoms. So if you do have an emergency, such as stroke-like symptoms or a heart attack or things like that, we don't want people to be fearful to come to the hospital because we do have safety checks very much in place.
Well, thank you so much. I've been speaking to Dr. Graeme MacLaren and Dr. Jyoti Somani. Dr. MacLaren is the director of the Cardiothoracic ICU at the National University Heart Centre, Singapore. And Dr. Somani is a senior consultant at NUH's Division of Infectious Diseases. Thank you to the two of our guests for taking the time to speak with me and for your hard work as well. Let's go back to Dylan for what else is making news today.
Singapore's non-oil exports rose for a third consecutive month. It rose 9.7% in April from a year ago, despite disruption brought upon by Covid-19. For April, non-electronic exports grew 12.8%, mainly due to the 174.3% gain in pharmaceuticals, a 66.3% rise in food preparations, and a 25% rise in non-monetary gold. NBA great Michael Jordan's autographed match-worn sneakers from his rookie season fetch a record $560,000 in an online auction. The Air Jordan 1s, designed for Jordan in 1985 and the first ever signature sneakers, were sold to collector Jordan Geller, who's the founder of a sneaker museum in Las Vegas. Like most of Jordan's basketball shoes, they are a mismatched pair in sizes 13 and 13.5. Top flight football in Germany kicked off over the weekend, the first elite-level football to resume after a 2-month break due to the pandemic. The Bundesliga's reopening has put pressure on other elite leagues like the English Premier League and Spain's La Liga. The EPL's Project Restart hopes to resume group training this week with a target to resume matches from June 12. La Liga has confirmed that group training will resume from today, with groups of up to 10 players allowed to train together, regardless of the status of the lockdown in their region. I'm Dylan Ang, back to you.
Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on The Big Story.